Namaste JVLs. In today's session, we will be continuing with shock. In previous session, we had talked about types of shock and the causes. In this session, we will talk about the stages of shock and the management. First is the initial state where the cells become leaky and switch to anaerobic metabolism. Second is compensated stage where there is attempt to correct the metabolic upset of the shock. Third is decompensated or progressive one. Eventually, the compensation will begin to fail, and refractory where the organs fail and the shock can no longer be reversed. Then these are the early signs. There is restlessness, anxiety, irritability, slightly increased heart rate, respiratory rate, and decreased body temperature. In late signs or decompensated state, there is restlessness, apathy, confusion, slowed speech, rapid heart rate, dilated pupils, slow to react, slow shallowness, irregular respirations. And this, if it is not attended, emergency care is not given, there is irreversible shock and death. Now we'll talk about the management of shock. First, the most important is monitoring of BP, heart rate, respiratory rate, urine output, blood CBC, pulse, ECG, ultrasonic, CT and X-ray. Then special monitoring is also required for cardiovascular, where we monitor central venous pressure, cardiac output, systemic and organ perfusion, muscle tissue O2 probes, near infrared spectroscopy and sublingual capnometry are the process for special monitoring. The guidelines to be followed are: first, to treat the cause; second, to improve cardiac function; third, to improve tissue perfusion. The goals of resuscitation are to increase the oxygen delivery and decrease the demand. The principles of resuscitation are airway, breathing and circulation. Next is the fluid therapy given in shock. First is the crystalloid solution of normal saline, Ringer's lactate solution and Hartmann solution. Second is colloid and solution, and third is the blood transfusion. For oxygen carrying capacity, only RBC contribute to oxygen carrying capacity through hemoglobin. Replacement with all other solutions will support volume, improve end organ perfusion. Dynamic fluid response includes infusing 250 to 500 ml of fluid rapidly in 5 to 10 minutes. Responders will improve. Transient responders may revert back, and there are third one, non-responders. Then next is vasopressors like phenylephrine and inotropics, dobutamine for cardiogenic shock and severe septic shock. Other treatments include correction of acid-to-base balance, steroids of like hydrocortisone, antibiotics, catheterization, control of pain, and monitoring and ICU. So this is all in this session. I hope you understood this session. If you have any doubts, you can post a comment. This session is powered by Digital 2.0 version of Jayoti Vidyapeeth Women University. Thank you.